righty. Good morning, commissioners. Chair Harrington, we were updated. Commissioner Fye should be about 10 minutes late, and we're expecting Commissioner Rogers anytime, but over to you.
All righty. Well, good morning, everyone, and welcome to the Board of Commissioners work session for Tuesday, May 21st. We're going to mix things up a little bit because we have a new face in the audience, and we'd like to welcome everyone here. Ms. Taniguchi Dennis, would you like to introduce our new team member?
Come on forward. I'm really delighted to introduce to the Board of Clean Water Services and to the broader Washington County team, our new Chief of Staff. Her name is Elizabeth Edwards. And she comes to us with great experience and knowledge, and she started all of yesterday morning. So she's already been fully immersed with the team. And I had all these really nice notes to talk to Elizabeth about, but my computer has turned into a brick. It's like frozen right at the moment. So I want to be able to welcome Elizabeth, and she's going to lead up our legislative agenda, really amplify how Clean Water Services looks for and attracts for grants. She's going to really amplify our climate action plan throughout the organization, as well as get Clean Water Services up to speed in emergency management. So there's lots of great things ahead that she'll be working on with the board. So with that, Elizabeth, did you want to tell a little bit about yourself to the board?
Absolutely. Good morning, board chair, board members. Elizabeth Edwards, for the record, new Chief of Staff for Clean Water Services. It's absolutely a delight to be here on day 2, introducing myself. And I'm a Oregonian, born and bred, proud resident of Washington County, and just absolutely thrilled to be entering into the proud legacy of Clean Water Services and be able to work with all of you and help carry forward what this looks like into the next coming years and generation. My background is largely working in or around public service. So I've worked for the federal government, state government, city government, and a little bit of county. And I'm really thrilled to be now doing a deep dive to help steward the Tuolumne River Basin as part of Clean Water Services. So looking forward to working more with all of you.
Well, great. Welcome to the team. We have just marvelous team members, both at Clean Water Services and Washington County. We as the board are very blessed. So thank you for joining us.
Most important question. What district?
I live in Commissioner Rogers' district.
Oh, okay.
If he says it, mine.
Yeah.
But, and obviously.
Obviously, she's never been out to district 4 very.
Well, you'll change that, I know.
I will.
Okay, well, thank you so much.
I'd like to say welcome, but most importantly, I'd like to say congratulations to Diane. Good job.
Wonderful. Well, thank you for letting me mix it up this morning.
Thank you
really
so much.
Appreciate it. Okay, we have our business meeting at 10 o'clock. So just want to check in on the formal agenda to see if there are any last questions. Nope. Yes, and we caught her mid-bite.
I did have one question, and it just, and I'm not up yet. So it was about on the consent agenda. There's a rather large increase to a contract from 6 million to 9 million.
Oh, yeah,
I'd just like to know a little bit more about that.
Sure, that's the adult, and Mira's here even. It's the adult nutrition contract. And is this the same one I had? Yes, that Older Americans Act. So come on up, Mira.
Thank you.
Thank you. Thank you, Chair, Commissioner Treese, for your questions. So these funds are actually federal funds, Older Americans Act, ARPA funds, American Reinvestment Program Act funds. So these are very separate from the county ARPA funds that we receive. So these are additional funds that our Older Americans Act program, which resides in Disability, Aging, and Veteran Services, would use to amend their contracts and provide additional services to the community.
Thank you. I just actually noticed the numbers and thought I was going to raise the question.
Yes.
So thank you for the explanation. I appreciate it.
Any other questions?
Thank you. That was Mira Samantel, our Director of Health and Human Services here at Washington County. Welcome, Commissioner Rogers. By the way, this is Chair Catherine Harrington, and thus far we have 3 of our 4 district commissioners, Commissioner Rogers, Commissioner Treese, and Commissioner Willie. Next, we'll move on to presenting the applicants for the Developmental Disabilities Advisory Council.
Right, well, good morning. I'm back. So good morning, Mira Samantel. I use she, her pronouns, Director of Health and Human Services. I'm so pleased to be here with Kirsten Oster today. She's hopefully becoming a familiar face for this board. She is the Program Manager for Developmental Disabilities, and she will be presenting applicants, the Developmental Disabilities Advisory Council, and then we'll end with a request to return with an action item for your board on June 4th. Go ahead, Chris.
Hello, good morning. Chair Harrington, Board of Commissioners. For the record, my name is Kirsten Oster, and I'm the Program Manager for the Developmental Disabilities Division and the designated support staff to our Developmental Disabilities Advisory Council. That's our agenda for today. So the DD Council is a 15-member council that serves in advisory capacity to the Washington County Developmental Department of Health and Human Services. The council provides input on program development, planning, monitoring, and funding matters. The council meets 1 time a month, an agreed upon time, and this past year, the majority of our meetings have been on Zoom. However, we've been able to support 2 hybrid meetings a year where we hosted an in-person option. Being able to offer the virtual and hybrid options have made it easier for council members to attend and be able to engage in important discussions. Members of the council are advocates, people accessing developmental disability services, professionals in the field, provider representatives, and family members. Positions on the council are not specified in the bylaws, and current council members are focused on leading with equity and building a council that includes a diverse and broad representation reflective of our Washington County community. Currently, 26% of our advisory council members are bilingual in Spanish and represent a variety of different cultures within the Spanish-speaking communities of Washington County. Including those members overall, 40% of the council members identify as BIPOC. A priority of the council this year is to raise awareness to key issues impacting the intellectual and developmental disabilities community and advocacy for the Spanish-speaking and non-English-speaking community members and service providers. A few examples of those key issues include ensuring adequate funding to local developmental disability programs, such as our division, finding affordable housing for people with intellectual and developmental disabilities, a continued emphasis on employment, and providing input on the division's focus on community outreach to BIPOC communities and other affected groups that do not engage in developmental disability services or community events due to systemic barriers. For this recruitment period, we had 4 vacancies with 3 applicants. 3 of those applicants are seeking reappointment. We have invited all applicants to recent council meetings and have included them in our resource sharing activities. In addition, as a division, we have been continuously expanding our community outreach efforts, including recruitment for the Developmental Disabilities Advisory Council. This has included redesigning the council's promotional materials to be more intentional about our work towards racial equity and service delivery, and providing the information in multiple languages, including information that interpretation services will be provided. For the previous 2 years, our services coordination teams have been crucial in the past recruitments and supporting family members to take the first step in public advocacy. Due to the tremendous growth of our division, our recent services coordinators have been in the beginning stages of developing those deep relationships and help family members feel more confident and supported when applying for the DD Council, and are already looking forward to next year's recruitment. The HHS department recommends the reappointments of Cindy Otis, Deborah McKnight, and Cindy Wilkins to the Developmental Disabilities Advisory Council. I put together a brief summary of each candidate. Cindy Otis is our first applicant seeking reappointment. Cindy is a woman who lives in District 1, and in her demographics indicated she is white. Cindy is also the referral for one of our applicants for 2023, Donald Scott. Cindy is reapplying because she wants to continue to be an advocate for adults with intellectual and developmental disabilities. In Cindy's current profession, she assists adults with developmental disabilities to become more independent and help them thrive in the community. Cindy highlighted her experience advocating for solutions to homelessness she brought with her and will continue to bring with her to the DD Council. Cindy writes, "During my 25 years of experience, I truly believe that housing is a top priority. Then providing individuals services and supports so they can maintain their housing. An individual cannot succeed unless they are able to feel safe, take a shower, wash their clothes, and have an address to meet their medical and needs and services. In addition, Cindy described in her application her commitment to racial equity and addressing systemic inequalities. I believe that if you want inclusion and equity, you need to include the race that is being excluded and ask them how they feel and want to be included, what policies and procedures they feel need to be changed or restructured in order for them to feel included. Through my years of advocacy, I've learned to pause and to listen. The council has deeply appreciated Cindy's insights, especially regarding housing, and look forward to her continued engagement on the council. Deborah McKnight is the second applicant seeking reappointment. Deborah, who goes by Debbie, is a woman who lives in District 4, and in her demographics indicated she is white. Debbie has shared she is an individual who has a developmental disability and was involved in special education throughout all of her schooling. Debbie is very involved in the community and is a part of FAME, a local nonprofit organization. FAME is a school of the arts, and they provide performances. They offer a variety of classes throughout the year, and Debbie shares that information with council members. Previously, Debbie had presented throughout the Portland area about the value of inclusion and assisting organizations to better understand individuals who experience an intellectual developmental disability. Debbie indicated on her application she'd like to see more low-income housing for the community and wants the use of the R word to be stopped. As a person with a developmental disability and accessing developmental disability services, Debbie brings with her the historical knowledge of how far the services system has come and how much farther we need to go. Cindy Wilkins is our third applicant seeking reappointment. According to her application, Cindy is a woman who lives in District 4, and in her demographics indicated she is white. Cindy's adult daughter has been accessing intellectual developmental disability services for over 20 years, and Cindy has been a passionate and knowledgeable advocate over the many years she has served on the council. Aligned with Washington County's commitment to addressing racial inequity, Cindy has demonstrated experience as an educator, social worker, and DD Advisory Council member. In her application, Cindy writes, "In my work as a social worker and as an educator, I challenge stereotypes, prejudice, and discrimination while promoting empathy, understanding, and social justice. Advocacy and policy change were key components in my work, and I continually work to advocate for policy change at the institutional and government level." Cindy, in addition, Cindy highlighted her experience advocating for solutions to homelessness she has brought with her and will continue to bring with her to the DD Council. "I have direct experience in providing homelessness services, such as to social workers, shelter managers, outreach workers, and housing advocates. I can offer insight into the needs of homeless individuals. Homelessness is often intertwined with issues related to physical health, mental health, substance abuse. I work closely with on the street public health providers, addiction treatment services, and mental health experts as they contribute to develop holistic approaches to addressing the complex needs of homeless individuals. Cindy's historical context, knowledge, and leadership has been a great asset in supporting new members in engaging in the public process, such as statewide advocacy and during the council's monthly meetings. The applicants who are reapplying have been contributing in a meaningful way to the council and division. Their historical knowledge has provided context for the DD Advisory Council to advocate for additional funding for community developmental disability programs throughout the state due to a forecasting discrepancy. This resulted in the approval of a rebalance, and the Washington County Developmental Disabilities Division was awarded approximately $2.4 million additional dollars to allocate toward our personnel costs to support our rapidly growing community. If reappointed, these members will provide the council and our division with valuable insight, historical context, and guidance as the division continues to grow and lead with race and equity. Thank you for the opportunity to present our candidates for the Developmental Disabilities Advisory Council. As a staff member that has been working with our council for over 2 years, I'm excited to be able to support this wonderful group of individuals who represent the community we support in Washington County. Thank you. I am happy to take questions from the board.
Thank you very much. Commissioners, do you have any questions or comments? Yeah. I think, commissioners, are you thumbs up with the?
Oh, yeah, of course.
Okay, well, so I'm thumbs up as well. And thank you for all of that information that you shared with us. I appreciate hearing it. And I have an idea, which, as Angie knows, these are just ideas. Okay. But yes, I wrote the attention. It was very clear with what you shared with us that our volunteer members are clear about what they're hoping to give. Recently, we had the opportunity to participate in the thank you celebration of all the volunteers on our many boards and commissions. And I'm wondering, as an idea, perhaps it might go into our comms, public affairs, community engagement arena. Sometimes I wonder, what is it that our board and commission members, these volunteers offering their time and their expertise and their passions in their own words, what do they feel they're getting out of this experience? Because that's something that, you know, we advertise a lot, that we're looking for volunteers and here's how it helps us. But these are individuals in our community, and they're offering so much, but I'm wondering, in their own words, what do they feel they're getting? So at some point, I think if we have the bandwidth, it might be nice to have a survey of the different members in their own words. What are they getting out of participating?
Yeah, so Chair, I hear that suggestion for boards and commissions as a whole. So I will ask that Daniel Ledesma and Amanda Garcia now look at how we can collect such information. I will just share just a quote that I received over the weekend from our community member chair of our budget committee, Joe Everton. And here's his quote, and he said, "It's okay if I share this. I am amazed by how much behind the scenes work goes into Washington County that we as community members don't give much thought to because the work is being done so well. We have it so good here. Thank you, County employees."
Yep.
Get chills.
Yep, it's tremendous. All righty. Well, thanks, but we look forward to the action of getting to appoint these members to the council, the advocacy council. Thank you.
Thank you.
All righty. Next, we're moving to some money. The proposed Washington County fee schedule for this upcoming fiscal year. Welcome to Mr. Munn and Mr. Weber.
Good morning, Chair Harrington and Board of Commissioners. My name is Greg Munn. I'm joined by Chris Weber and from County Finance. And about a year ago, Chris started. And so I think 3 weeks into his starting, he presented the fees proposal for last year.
And you survived and thrived.
You're still here.
Yeah, yes.
It was an opportunity that was presented, and I don't know that he knew he was getting into, but he did a great job and has really taken a leadership role in here. So this is a big chunk of what we do. So today, the purpose of this meeting is to give you an overview of the proposed rate schedule for the next fiscal year. And the rate schedule is the rates in the rate schedule, I should say, are defined by a variety of different state statute requirements, the OARs, the
Board policy.
It's across the board. So it's really a collection of fees and charges that we charge the public that's brought together in one presentation to the board. And the focus really is to share with the board the major changes from year to year. So we gain this pathway forward and help to understand what the fees and charges are to the public. There's almost 1,300 different rates and fee charges in this model. So the finance department, largely Chris, really manages this. He's the hub for the county and works with all of the other departments to bring this information together for you this morning. So I'm going to turn it back over to him. He's going to give the highlights as we move forward. After this meeting, there'll be an opportunity for the board to approve the rate charges for next year. That'll happen at the same time as budget adoption in June.
Thank you, Greg. Good morning, commissioners. Good morning, everyone. I'm Chris Weber, budget analyst here in the finance department.
Kevin.
We're getting the presentation up. Don't worry. Jerry, do you need a pen?
Nope.
Welcome, Commissioner Five. Thank you. Oh, I can see it on our magic screen in the back. Over there, over your right shoulder. Our producer in the back of the room,
Suspensions building.
the magic closet.
Right there.
Yep. Here we go.
Presentation.
Openness and transparency in action.
All right, well, thanks, everyone. So the agenda here, just a quick overview of what the fee schedule process is here at the county. And then I'm going to go through a department by department highlight of the significant changes. And then next steps and questions. And you can interrupt me anytime for questions.
Thank you, Chris.
So the fee schedule process starts in November. Finance distributes Excel workbooks out to the departments with all of their current year adopted fees in them. And that's kind of a starting point for them. We provide a training for them on what to do, how to review their fees. And basically the departments have them from November through January. They submit them in January. And that timeline makes it possible for them to incorporate the fees into their revenue calculations for the operating budget. And then we get to today where we review this. And on June 18th, the board will adopt the proposed 24-25 fee schedule. So the analysis that departments do, they are encouraged to thoroughly review at least 20% of their fees every year. And they're required to complete a fee review template and submit it for all fees increasing by more than the projected CPI West increase, which was 4.4% when we started in on this. So anything more than 4.4%, they had to show their work on increases. Departments this year were also required to compare fees with Multnomah and Clackamas counties. Last year they were encouraged but not required, and that's an every other year thing. So if you look at the marked up fee schedule, you'll see the Clackamas and Multnomah County fees side by side with ours. So total proposed fees, as Greg said, 1,255, 536 in LUT, 250 in public health, 4 departments with about 70, and everyone else less than that. So you can sort of see between LUT and public health, almost 3/4 of the fees. So this presentation is really focusing on changed, new, or remove fees, not worried so much about, existing fees that aren't changing. So 509 of the 1,255 fees are changing in this fee schedule. That's 41%. 493 increase, 4 decrease. There are 9 wording only changes, clarification of wording, and there are 3 fees that are restructured without a fee change. There are also 8 new fees and 13 fees to be removed. So on to the department by department summary and highlights. This is the general government departmental highlights. For the all departments and administrative office fees, no changes for their 23 fees. A&T, 7 of 74 fees change. And these are all small increases from 3.6 to 4.3%. Largest dollar change is $7. So not many changes, not very big dollar changes there. County Council, 1 of 2 fees changes. The public records request or discovery fee for legal staff per hour decreases from $276 to $263. That's an internal calculation they do every year. And then elections has no changes for their 28 fees.
Why would they decrease the fee?
I looked at that.
Is there a formula to this and they
Yeah,
had to meet
Their
the
costs,
formula?
their costs went down. They spent less time on.
Yeah, we have a cost formula that our hourly rate, so it decreased this last year.
Any questions on those?
Yeah. Yeah.
Okay.
Seems strange. but-
Attorney fees going down anyway,
We're helping you out.
public out, yeah. Well,
So on to departmental highlights for Health and Human Services. Disability, Aging, and Veteran Services have 3 fees. They're changing one of them. Again, internally calculated private case management fee per hour. This one increases from $70.87 to $76.71. So that's over the CPI West, and they did turn in a cost calculation template for that, as did everyone. So emergency medical has 23 fees. They're changing 13 of them, and they have 2 new fees, and 6 fees are being removed. So a lot of action here. Of the 13 fees that increased, 9 of them are increasing by a standard 3%. And the other 4 are different amounts. So the other 4 are the replacement license and license amendment fees are going up from $30 to $35, which is a 17% increase to get to full cost recovery. The CPR AED training class goes from $350 to $600. That's a 10-person class, so $60 per person. And the market is between 59 and 80. So that's actually low end of the market. So it's not as bad as it looks. And then the combination CPR, AED, and first aid training per student rate goes from $74 to $100. The market on that is 89 to 126. 100 is a little below average for the market.
So I guess my question to that was, if we're trying to incentivize people to move into this profession or enhance their abilities in this profession because we have significant vacancies, why would we increase something from 350 to 600, which would feasibly take it out of reach for someone? So that seemed counterintuitive to me.
That's it's totally about cost recovery on that.
So who's cost recovery? Or is this something we do? Is this okay?
This is a program that is full cost recovery. So it is not being offset by a special fund or general fund to provide this service. So this is one of those examples of the cost of service to delivering these trainings.
Is there any grants available? I mean, why couldn't we have AMR or some other agency provide some grant monies to this so that, again, it would be still incentivized?
We can follow up and see what opportunities are. I can say that staff continuously try to pursue all options for other funds, but we can ask those specific questions, Commissioner Willie.
Yeah, and again, it's just because, you know, the reports we hear back is why their ambulance around the 3 county areas are all underperforming because they're saying they don't have enough people.
This isn't about EMT training. This is
But this is a training that could enhance EMT is what I'm saying. It's not a requirement to be in there, but these are skills that people would enhance their services.
So some of the individuals that take the trainings are, for example, some county employees take these trainings. I would put this in the category, this is not a mandatory service that we need to provide. This is an optional service.
Okay, so give me a.
employers
So,
are looking for someone to come in and train their personnel.
so is this a popular class? I mean, do we do a lot of this?
I would suggest that I collect the questions and follow up because I don't
Right.
have all that detail.
All right, just, you know, you take something from $350 to $600.
So this is also as we move forward in zeroing in on what are our mandated programs and which ones are optional for additional county streamlining. This is set up as full cost recovery, right? Just like our passport program is. But if we want to reduce the size of our employee base, one way to do that is to take these optional programs and let the private marketplace deal with it.
I was just going to add that we may not end up being the provider of choice.
Right. Well, that's right,
And
right?
that's-
It's just about accessibility.
And that's not a problem to me if it's.
If
we're-
that's intentional.
Yeah.
Then yeah, I get that. So let's make it intentional if we're gonna do that. So I'll wait to hear some statistics on this.
Yeah, we'll collect the information on the program, the utilization side of it and send that back out.
And along with that is, for various services as we go through the setup for the following proposed budget year. We've already asked Ms. Angie to find out what of our services are required, mandated, and which ones are optional, right? The ones that we're doing just because long ago, someone asked county government, could you do this? And so we're going to be learning a lot more about those various programs that are embedded all throughout the organization. So team members will need to include in the description, when did it start? The why of how did we get into this business?
Okay.
At the end of your presentation or at some point, are you going to tell me how you go about full cost recovery? I've always been curious about that. Everybody says they do it. And I don't expect a written document or some big explanation, just.
Yeah, I can
think
show
so.
you some really interesting examples of Excel spreadsheets that people did to do that.
Sure.
Yeah.
Nobody else wants to see them, but I.
Yeah.
I just want to know how you do
You
it.
assume.
Yeah, well, maybe others, yeah.
Yeah, not only the mechanics that are interesting here, but making sure that we stay on top of the rate increases as we go. So we don't want instability built into our rate increases. We want them to be stable as to the extent that we can, so we don't have these major increases in fees. So that's another goal of that. But yeah, we got the spreadsheet. You'll like it.
Next bullet point down are the 6 remove fees. So there were fees for fire service ambulance providers and non-emergency ambulance providers, and they were at the same rates as the other ambulance fees. So they've just been consolidated, and they got rid of the fire service ambulance provider specific fees and the non-emergency ambulance provider specific fees. So same rate, just less fees. On to the next page, more public health, more health and human services. Public health has 250 fees, 68 are changing. They've got 1 new fee added and 4 fees removed. So of the 68 fees increasing, they increase from 4 to 7%. And again, to achieve full cost recovery, we have cost review templates on all of those. And the fees that are increasing include schools, childcare facilities, jail inspections, subsurface related fees, and other inspections. Just wanted to give an example. So the largest dollar increase is for construction and installation permits for on-site sewage disposal, for sand filtering and gravel filtering. There's about 5 of those fees, depending on how many gallons you're doing, and the largest increase is $123. And those are all 5% increases. The new fee is for an expedited food service license for restaurants, and that is they set it at $2,115. There have been requests from owners to have an expedited plan review fee, and they calculated the fee by multiplying the regular plan review by 2.5. So it's 2.5 times the regular $846 fee. Next bullet down, 4 plan review fees for pools, spas, wading pools, fountain spray pools are being removed as, that should say OHA. OHA is performing pool plan reviews in the county in 24-25, so those fees are leaving. Yay.
We had this conversation last year and we were surprised at the number of pools.
Yeah.
That's in the county. So anyway, just remembering the last conversation.
Last HHS function, animal services, no changes to any of their 66 fees. Next departmental highlights is land use and transportation. This is where most of the changes are this year, and I think last year too. Of their 536 total fees, 386 change, so 72% of their fees change. starting with building services, 143 of their 160 fees go up between 7 and 9%. It's an average of 8.5% if you take them all into account. And that follows last year's 50% increase in R&O 2312. And basically, we're a year down the road on those, and they've indexed them to cover increases in staffing, indirect, vehicles, training, software, and they've come up with an average 8.5% increase. And those are the very same fees that were in the 50% increase last year.
Good work. Following up on that. Thank you.
Very similar thing in current planning, 218 of their 245 fees are increasing. This time, every one of them is exactly 8.5%. They're also adding 3 new fees. And those 218, they were all included in last year's R&O as well. So same situation there. And then there are 3 new fees. There's a plan development or transit-oriented district, Measure 49 single dwelling. That was set at $7,125.25, which is the same as an agricultural dwelling, which is already in the fee schedule. And the other 2 are building permit reviews, additional plan review due to changes, additions, revisions, multiple reviews per hour, set it at $170, and it covers staff time when an applicant submits a revision or addition to an already reviewed plan. That's new. And the next one down is a research fee per hour of $195. They said planning staff routinely need to resolve planning related issues that do not have quick answers. More land use and transportation changes. Long range planning increases 12 of the 37 fees. But these are not fee increases, they're increases on initial deposits on cost for permit work to get closer to a more appropriate deposit amount. And the way those work is the county collects initial deposits, and then the deposit is used to pay off costs as they occur. And the deposit does not change the ultimate amount that applicants are charged. So 11 of the 12 increases are 4%, just to keep up with personnel costs. The next one is the largest increase in the fee schedule this year. The deposit for plan amendment application request, initial deposit on cost increases from $8,500 to $20,000. So this increase ensures adequate compensation, avoids county subsidization of applications, and allows applicants more certainty about expected costs. There are very few of these. There have been 3 in recent years. The most 3 recent totaled $28,000, $24,000, and $21,000, so all above the $20,000 deposit. And there's also some included other jurisdictions charging for similar combination of procedures. And as you can see, 20,000 is either in the middle or towards the lower end. On to road fund engineering. No changes for their 30 existing fees. 1 new fee added for a pre-application meeting. $200 fee covers 1 hour of staff time for increasing number of pre-application meetings that engineering staff. 1 of 28 road fund operations fees changes. That's statutorily mandated. Motor carrier trip permit goes down again from $8.50 to $8. The surveyor is changing 12 of 36 fees. 1 small increase to file a survey increases 4%. 2 structural changes where they're combining fees with their base deposits, so no dollar change. And then 9 wording changes where they clarify what the fees are for. Next up, culture, education, and recreation. Westside Commons has 77 fees. They're increasing 28 of them. Wingspan has 11 space rental fees, and all of them are going up by 4% to cover increases in personnel, utilities, and county cost allocation plan expenses. So the largest dollar increase is for the Expo Hall West, which is the biggest space. It's increasing $127, 4%. They all increase 4%. The fairgrounds is increasing 14 picnic space rental fees, also by 4%. And again, the largest dollar increase is for the per day fee for the entire festival grounds from 1836 to 1910. So up $74, 4%. And Westside Commons also has a couple of other fees that one of them goes up 4%. And the electrician per hour charge is now included in their contracts. So that has changed. Then we go on to parks, no changes for their 30 fees. Moving on to public safety and justice, community corrections, 7 fees. They're changing one. The electronic monitoring service goes down to $9.75 from $15 due to a rate adjustment in the new contract with the contractor VigilNet. And they're eliminating a fee for a compact investigation fee. They haven't charged it since the pandemic. And they want to align with state statutes around not charging fees to justice-involved individuals. So that comes out. Justice Court, no changes. They're removing a fee, the $88 eviction trial plaintiff fee. It's a duplicate of the filing fee, and they realize that, so they're taking that out. Sheriff's Office, 4 of 78 fees change, 1 fee eliminated. Small increase to the delinquent application renewal payment of a alarm system penalty from $1. The pass-through deposit increases for real property foreclosure and sale from $1,040 to $1,070. The prisoner transport fee goes up to $1.20 per mile from $1.15 a mile. And they've restructured the uniform security delivery fee per hour. It used to be a 4-hour minimum of $422, and now it's $1.15 an hour. And they remove the fee for each additional hour. They just charge by the hour now.
Can I ask you a question out of curiosity? I mean, you're going to show me full costing, I get that, but it's really worth the effort to go through for a nickel or $1? I mean, it's your time is more valuable than that, than the fees that we're probably generating. So I mean, it's just
I think it's worth it.
in terms of total dollars or what?
Also discipline that we have
To do it, to say we did it.
Accountability to our community.
Hence the question earlier, should we even be doing some of this stuff? Some of it we got it, like transport. Okay.
One last category.
Yep, a few more public safety and justice. Law library, no changes for their 7 fees. District attorney, no changes for their existing 10 fees. They're adding a new fee for digital evidence tech time at a cost of hourly staff time.
Who pays that, General? How does that, who are the customers of that?
So in the law library, it's not the customers. that pay.
No, it's not the law library.
District attorney.
District attorney one.
Oh, pardon me.
Yeah.
Yeah, we,
So in some cases, it may be cities. That's the most common, but we can follow up if it's anyone in addition to cities and repayment. And I
what
see
caused
Aaron
me to
Calvert
ask
nodding, so
was
I think
that
I
during the budget, right, we heard about the cost of reviewing digital evidence. So it was like, oh, okay,
yeah,
could be related but different, and that's fine too.
yeah, the DA's office has been working very closely with our city partners because there's digital evidence practice that benefits both our city policing as well as the DA's. So to help cover the DA's costs, this has been something that Mr. Barton has been working on for the last couple years.
Okay, no, just curious. That's
All right, juvenile conciliation, no changes for their 8 fees. Open it up to any questions or discussion.
So commissioners, hope you were following all that.
Yeah.
And there's more information in your packet. Now's the time to ask questions.
I have a couple questions. First of all, the first one is really more of a statement. When I look at these fee increases, we've reviewed a lot of the fee increases in LUT. There's been a lot of discussion during the time I've been here about trying to meet and recover our costs. I'm comfortable with the communication level that's happening with the users in that regard. I don't know if I'm as comfortable with the communication that's happening when I look at fee increases for schools, for childcare programs, that type of thing. And I just want to make the statement that I really encourage that conversation to make sure that those conversations are occurring. So that's the first thing. Second thing is this, and this is a question, just having gone through the budget, I remember looking at a chart that had an element of what the fees are in relationship to our overall revenue, but I don't remember a percentage. Can you provide some perspective for me about these costs in relationship to our revenue budget?
Yeah, if it's okay, we can summarize that in the email back to you that explains it.
Okay.
Yeah.
Okay.
The chair had to step out, so you can continue.
So I want to look at slide 11, which is on primarily, I guess overall, we agreed to an accelerated rate increase last year. Instead of spreading a 50% increase over 2 years, we went all at once, all in. And I thought that was with the proviso that we would hold serve for a year or two before we moved to another fee increase. So, so now we have another fee increase. So that's a little confusing to me, I think. I'm not sure. Maybe I don't remember the messaging correctly, but that was what I remember. In regards to the deposit for plan a minute.
Mr. Lilly, Ms. Wardell can actually speak to this fee.
Okay.
So I just, I think finance is being the steward and the shepherd to make sure that we are fully costing our services, and where the departments who are charging these fees have a bit more context. And so I want to make sure that we get that direct information from the departments. Ms. Wardell?
Yeah. Particular fees. Could we actually go back one slide? So this is the long range plan. We want to go back one more. This one. So if you recall from last year, we had commissioned a consultant to do about a 2-year effort of looking at our service levels and matching our fees with our actual staff costs. And they came out with several different recommendations. 3 of those recommendations were, number one, you need a large one-time increase to catch up with this backlog of the last 20-ish years of not catching up with your staffing costs. And then going forward, so you don't end up in this situation again, you do need to do an annual fee increase. So this is the first year of that annual fee increase that we committed to, so that we didn't end up in that negative situation that we'd been in for so long. And then the third financial recommendation they made was to implement a technology fee to take care of some of the large software costs that we're incurring. That's what we decided to put off for a few more years. We just don't have a really good handle on the technology fee component yet. So we're moving forward with the annual fee index increases, and we'll look more closely at the technology fee possibly for next year.
And the 7 to 9% increase, as well as the 8.5% increase, are reflective of the costs that have increased since we did that major jump.
Exactly. So we looked at our program cost increase for the next year, and that program cost increase takes into account increased staffing cost, increased vehicles were mentioned. That's a big cost for these teams. Our inspectors, for example, are out in the field quite a bit, training, licensing, certification, and all of those various costs. And we got to needing an 8.5% increase, which generally tracks with inflation and what our staffing cost increases have been.
And is that over just the last year or 2 years?
That's over a year. Mm-hmm. This also on the building side takes into account adding in 2 inspector positions. We realized that we probably dropped too many staff inspector positions, and it's been difficult for them to keep up with their workloads. So we think that this will stabilize the number of staff that we have on that team.
Okay, so go to the next slide. And if I understand correctly, we're increasing the amount of the deposit considerably, but the overall cost of the thing is not increasing. So does that just mean we're trying to
Correct.
get trying to recoup our costs earlier in the process?
Exactly. So long-range planning is different than current planning. Long-range planning is not fee supported generally, but plan amendments are a little bit different because plan amendments go through actually the Planning Commission for an urban plan amendment. It's quite a bit of work to process them. And you can see here, the last 4 bullet points are comparable jurisdictions and how much it generally costs to do this work. So what it means when we only charge $8,500 is that we have to keep going back to the applicant and invoicing them and making sure that they've paid for the full cost. We think it's easier just to collect most of it upfront from them. It also helps the applicant understand reasonably how much this is going to cost them. It's a little bit misleading to say, pay $8,500 and now you're going to actually end up owing us $22,000 or something like that. If it ends up costing less, let's say we did get through one for only $15,000, we would reimburse the applicant for that.
With
Okay.
interest?
I'm not sure about that part, but they don't cost less than $20,000. So I think we pointed out the last 3 have all cost more than $20,000. So we think this is a reasonable cost recovery plan.
Okay, thank you.
So this will be coming back to us over the next 3 weeks or so?
Yes.
Yeah. Great. Is everybody all set? Terrific. Thank you for the
Yeah.
thoroughness, not only to you, but also everyone in each of the departments. Great. Well, that's it for now. We're going to pause our work session and convene in our regular business meeting. We will reconvene here at hopefully 11:15. And then after the lunch break, we will have board and leadership communication and then another segment as well. And before we move from the business meeting to our next topic, I'll do the agenda then, the exec session. Okay? Cool. Great. See you later.